Hey, everybody, and welcome back to the Tonic Accord podcast. I am joined here by my friend and colleague, Drew Nepley. Drew, how's your day going?
It's going all right. It's going all right. A little bit warm out here in Southern California now, which I'm thankful for. And yeah, I'm thankful that I am not infected with the coronavirus.
Yeah, that's definitely fair. Today I think we should have a decent discussion about the coronavirus. Lucky enough, as I'm sitting here in Spain, I keep checking the news, but there hasn't been a reported case yet. But it is funny. There was a tour bus in Malaga, which is in southern Spain, and I think it was a tour bus full of Chinese citizens, and one of them got sick from I think driving or something, and they pulled over to throw up, and the authorities showed up and took everyone off the bus. But it turned out to just be sick in a bus. But there's a lot of fear. There's a lot of panic going on about it. And yeah, I mean, I have to admit, earlier in the week when I kept seeing the numbers rising, I was a little nervous myself. But after reading more into it, I don't know. But for today's episode, yeah, I'd love to talk about it. For people that don't know or are maybe trying to drown out all the noise about it, this was an outbreak that actually began back in December. A lot of people believe it's because of the repeated mingling between people and animals in China. This originated in a fish and animal market in the city of Wuhan. People keep calling it a small village. I've seen that used a lot, but it's a town of over 10 million people. So let's not joke about that, right? And but so basically, this virus they think was spread from a bat to potentially a snake, is what I've been reading.
Yeah.
And then it eventually crossed over to humans. And since then, well, the death toll's been rising and the numbers of infected are rising. In China, as of this recording, there's over 9,000 reported cases.
Right.
In Australia, there's 9, and a bunch of other countries, there's less than 10. The U.S. has 6 right now. Thailand has 15, Italy 2, Germany 5, and a bunch of other countries. I'm not going to go down the whole list, but it is spreading. And I think there's a lot of misinformation and a lot of panic, and everyone's kind of wondering, should we be worried about this, And the good news is that symptoms, well, not good news, but symptoms resemble the flu, but can also include pneumonia, which can be fatal. But only about 20% of the reported cases are severe and need hospital care, and only about 2% of them have been fatal. So it's too early to really tell, but it actually sounds like the flu is more dangerous. But I think this virus is being covered a lot just because it's new, and the media like to pick up on new sensational stories. Obviously, it's too early to really know, but that's kind of my take on it. And this virus, it comes from other coronaviruses in the past, such as the SARS one and the MERS one. But right now there is no vaccine or medication for this specific one. And so it's going to be interesting. And I think as we're seeing in China, it's testing their system. It's testing their infrastructure. They're having the largest quarantine and mobilization in history, which is pretty interesting. So yeah, what do you think about that?
Yeah, I think first off, it is getting a ton of media coverage because it's the new kid on the block, right? Like it's the new virus that had just been discovered for the first time in humans in December. And I think it also gets a lot of panic and attention because it's spreading faster than SARS, right? SARS was a severe acute respiratory sickness. What is the S? I'm forgetting.
I think syndrome.
Syndrome, yeah. And so SARS, it took 9 months for SARS to get to around 8,000 confirmed cases. Now it's only been half a month, maybe, actually it's been a full month. And we're at over 9,000 confirmed cases. So
yeah, just in China,
right? So it's definitely spreading quicker than SARS is, right? And that's where I think a lot of the concern comes from. But what you just said is, based on everything we know, it's all early numbers. The World Health Organization puts it at around somewhere between 2 to 4% fatal, which is less than SARS. So that's the good news is, well, if you're relatively healthy and you have access to good health care, you'll probably be fine. If you get it, you'll probably be fine. It's the people that that don't have access to good health care or may not realize they have it, and then they think they just have a regular flu, and that's when it can get kind of dicey. But the good news is it looks like it's not that fatal. Obviously, it's a tragedy that we have had deaths. I think we're up to over 200 deaths now. And that's obviously a tragedy. But it seems like if you're an American, again, this is coming from my American's perspective, it seems like there's not that much to worry about. We did have one case that popped up in Orange County, and I live like an hour and a half north of Orange County, and I actually have to go down to Orange County this weekend for a Super Bowl party. So, I'm a little on edge, but I think I'm fine. They obviously, they quarantined the people, and it hasn't spread from that one in Orange County. I know that there's one in Chicago that the lady who had it accidentally gave it to her husband. And they're both, in the hospital and making sure they're not spreading it. So that's the only time I think we've had a case in America where someone spread it to someone else and it was the spouse. So that's as far as we know for that. So I think I should be okay going down to Orange County. I think I should be okay.
Fingers crossed.
Fingers crossed. I'll wash my hands. And that's not a joke. Actually, the World Health Organization says the best way to prevent it right now is to consistently wash your hands. If you use tissues, put them away from people. Because there's no vaccine yet, right? There's no medication that we know of yet, and based on what we know, based on the New York Times the New York Times is saying that the best case scenario is a vaccine in a year. Mm-hmm. So that's a long ways away, right? We've only had a month. We've had 9,000 confirmed cases, but that's what they say. So we'll see. We might not even need a vaccine. That's what happened with SARS. Is we got the vaccine after like 20 months, but after 20 months, we had already quarantined so well that SARS had basically died out. So we may not even need the vaccine.
That's a really good point.
What about you? Are you worried about it, or are you sleeping sound?
I'm a hypochondriac when it comes to health. I'll admit it. I don't do very well with things, and I'm really bad about going on Google and searching about things when I'm worried about things. And so it's kind of a dangerous, vicious cycle. But the more reading I've actually done on this, it doesn't, I think you're completely correct. The one thing, though, that does kind of alarm me, which is that virus can spread during the incubation period when there are no symptoms.
Right.
And so to me, you're right. The fatality is not high, but just the fact that you can potentially have it and not know and spread it is kind of dangerous. But I think that's why the numbers went from 282 on January 20th to over 9,000 now so quickly, is because people don't know until they actually are symptomatic. And by then, who knows how many people they could have spread it to, And The Economist has a good point, is that they say there are two things that explain why this new disease is so alarming. One is that at first it spreads exponentially. As tens of cases become hundreds and hundreds become thousands, the mathematics run away with you. And they said the other is that it's just a profound uncertainty linked to this. And it's true. I think the uncertainty is what scares me, because I'm a person that likes stability, and this uncertainty scares me.
Right.
But I think you're completely right, is especially if you live in a country with good health care and you're moderately healthy, I think you'll be okay. Like the flu, it seems to only be fatal for very young and very old people, or people with, lung diseases or other health problems. So, yeah, I think you're right. For me, the bigger issue is I actually think this is going to shake China to the core in a more political and social way.
Yeah.
First off,
like you said, there's millions of people on lockdown, and that will have an effect on their economy.
Oh, completely. And The Economist also says that China's growth in the first quarter could fall to as little as 2% from 6% before the outbreak. And as China accounts for almost a fifth of world output, this could be a noticeable dent on global growth. And then the second problem is that I've been reading from the World Health Organization's website and from a few other articles in The Guardian and The Economist, is that quarantines are not always the best idea, because they produce a lack of trust in government. And also, you're not pinpointing the cause of the virus as much as you're letting it move freely through a city. And so I'm more worried that, yes, China, it's very impressive, the mobilization of doctors and hospitals that they have created. But it is a little bit concerning that they have a lot of hospitals, but not a lot of quality care. And so it is a growing issue where I'm worried that China's going to have to grapple with maintaining their image and saving face, and also, coming to terms this is a serious problem. Now, they have talked to the World Health Organization. They reported it quite early. And that's a lot different from SARS back in what I think it was 2003,
Yeah.
where they actually covered it up for I think several months before actually releasing the information. So they are more transparent, but they kind of have to be with where the world is since then, you know?
Yeah, that's the problem is I think they learned a lot from SARS, right? They learned a lot that, well, we covered it up and then it looked really bad after that. As far as infections go. And then they also implemented a like a screening and surveillance thing in their medical, a medical practice was required to like screen and surveil for these weird respiratory syndromes. And so the Wuhan virus was actually discovered through a medical surveillance system that they set up after SARS. So it shows that like, okay, they did take steps to like, how can we better prevent this in the future? And they were able to identify the Wuhan virus because of that system. So that's encouraging. China consistently though has a problem with censorship, and there have been reports that some journalists in China that were reporting on this early were being asked to take down articles and being censored, and that's never a good thing. They did go to the World Health Organization, but I still feel like China's so conflicted about how it wants to save face, and they've been known to get numbers wrong. So, yes, that the World Health Organization has praised them for their quick lockdown, and that's all good. And the ability to detect it with their medical surveillance system, that's all good. But we still have to be at least a little bit skeptical of their numbers, just to be on the defensive, because not only with viruses like SARS, where they were kind of downplaying the importance of it, but they do it with other catastrophes, right? So just for one example, in 2015, the Tianjin explosion at a chemical plant, they originally reported that there was 14 deaths, and then later they admitted that there was 44 deaths, and then after a couple weeks of investigations, they had admitted that it was 173 deaths. And it took, and they were actively censoring people, right, on Chinese social media sites. Again, you have to remember, China's social media is kind of its own bubble outside of like the world's social media. So so the Chinese government has more control. They had blocked like 10,000 different posts about Shenzhen and explosions, and that's just not good, right? It doesn't like you mentioned about like having trust in your government. It doesn't really foster that trust, and internationally, it doesn't foster trust between governments and how they report these catastrophes, especially now that we have a virus that can affect other people. I think China needs to realize you have to build trust and internationally, have coalitions with international groups to tackle some of these issues. So I think this is a good example of they're kind of coming around to that, but we always have to be skeptical of the Chinese government because they have a history of just basically lying.
Yeah, I think that's a really fair point, and you touch on it well, is that, yes, they reported to the WTO the virus. Sorry, not the WTO, the WHO. But we don't know actually the specifics. I mean, there's a lot of unconfirmed reports that have come out of China saying that the numbers are double or even triple what have been reported. The death count is higher than people think. And obviously this is unconfirmed, but there are interviews with Chinese people saying is that you don't even know the full extent. We don't know the full extent of this, And I know the mayor, I think, it was the mayor of Wuhan, has come into heavy fire for not reacting quick enough to it when there were early reports. And it's true, is that it's really hard for a country like China, which is so closed, to be so open in an issue like this. And yeah, you're right, they have gotten much better since the SARS issue. But I just like you said, wonder how this will affect them internally and externally. I mean, if the economy is shrinking, and now you have this cry out from Chinese citizens over how the government is handling this. Plus, you have these Hong Kong issues. I do wonder what the long-term effect is going to be on China for this. And like kind of a fair hypothesis I have that I was kind of thinking about earlier is I wonder what this is going to do with Hong Kong and Chinese relations.
Right.
Because Hong Kong has closed their borders, and they are even more now divided and against Chinese control. And I wonder if this is just maybe going to be a catalyst for growing issues. And so, I mean, I think China's handled this well. Like you're talking about that technology that helped recognize this early. I think Chinese technology and the Chinese health system are doing fine, but it's the government that, again, like usual, is bringing them down in this. And so it's going to be interesting to see, what the next step is. But luckily, technology, has really worked quite well even since 2003, and so I'm not particularly concerned.
No, yeah, I'm not. And again, the thing that I always have to remember is the fatality rate, right? Like, I'm in my 20s. I'm relatively healthy. I have health care, and I can go to a hospital down the street. That's good. So even if in the very off chance I get it, I think I'm going to be okay. So it's going to help me sleep at night. As far as the unconfirmed cases, that's kind of also, I was watching a live Q&A with the WHO, and they had mentioned that because of the low fatality rate, not all cases are even reported. Like if you are a rural Chinese person, that, you might just think you have a flu, right? And it might be a mild case of the coronavirus. Like you might, all right, well, I just got to sit down for a few days, dap my head with a wet towel, eat some chicken noodle soup, whatever, right? And then you're fine. You might not even have known that it was coronavirus. So you didn't report it. You might have passed it on, and then, but you get a mild case of it. So yeah, your family gets a little sick, and then it's over. You might not even know you had it in the first place. You know what I mean? So the nature of the virus itself, kind of lends to probably a lot of unconfirmed cases, because people just probably think they have the regular flu.
Yeah, and on that point, it's actually interesting because there was a modeling done by academics in Hong Kong, and this model that they ran, this is reported by The Economist, suggests that as of January 25th, closer to 20,000 people should already have been affected inside China. And obviously this is just a model. But based on the data they have and what they know about this virus, they basically say that 9,000 just seems very underwhelming for the amount. And it's true. I think, if you just have a cough and maybe a runny nose and it doesn't get much worse, you're probably not going to report it, And so I think that goes into it, is that maybe this is growing faster, but it's just less severe than people think. Because,
right.
Some people even think that this could just become a recurrent seasonal infection, because a lot of coronaviruses are responsible for the common cold. So while this is being blown up and there's deaths, all we know is that, like you said with SARS, where they actually never completely eradicated it, maybe this will just be something that comes up and the effects on most people are minimal.
Right.
I don't know.
Or it's just quarantined effectively enough that it just kind of dies out.
Mm-hmm.
Yeah, hopefully. I do know that the United States chartered a plane to bring back, what was it, like something like 100 Americans from the Wuhan area, and then they've all been quarantined. I saw that earlier today they reported that one of the passengers, who asked to remain anonymous, said that the quarantine was a good thing. So they're going to be quarantined for 2 weeks, which is what we know at least is the incubation period. They're going to be quarantined for 2 weeks, those 100 people from Wuhan. And then, and so at least one of those people says it's a good thing, right? I imagine being quarantined is not fun. But I also imagine that it's a necessity, right? And, we definitely don't want it to start spreading around the United States any more than it already has. But I feel optimistic that this will blow over. Again, it is a tragedy that there's already been deaths, but I have a feeling that now that, because governments are working together, like I saw that China is allowing international help from the WHO to go in and help investigate the virus. Australian scientists have already mapped out the genome. They don't have a vaccine, but they have the first steps that you need to get to a vaccine. So there's a lot of encouraging news, and I hope this starts to die down soon, because you're right it could have a big economic impact. And we've already seen that there was a dip in the stock market in the United States when now it's kind of gone back up. But over the coronavirus and its effect on growth. So it has a larger impact than just health.
Yeah. Yeah, and I think, like I said earlier, I think that's the main impact that's going to come out of this, is more the economic, social, and political side than the actual health, the health aspects of it. I do want to touch on kind of an unmentioned part of this. It's kind of the more pessimistic side of this, because I think this has actually been a relatively positive discussion about it, which is, it always makes me feel better. But I was reading the BBC today, and it's something I've been kind of thinking about for the last few days, is that, I mean, a lot of people in the 20th century thought that by the 21st century, we would have pretty much got rid of global pandemics and global diseases, just by the way technology and medicine were going. But the BBC and a few other articles I've read basically argue the opposite. They argue that with the proximity to humans and animals and the growing inequality and climate change that are going on in the world, that it's more likely we're going to have a lot more mega viruses, and maybe one that could be the plague or the epidemic that, you know, actually does have a giant stab, like the Spanish flu back in, I think, the 20s. And it's true, is the point they bring up is that the Australian fires are bringing people in very close proximity to animals, right? We've seen all those reports of kangaroos and koalas and other animals showing up at people's houses fleeing the fire. Right. And this proximity of people to animals is just becoming more and more common. I mean, and like, to give other examples, the HIV/AIDS crisis of the 1980s originated from great apes. The 2004 to 7 avian flu came from birds, and pigs gave us the swine flu in 2009, and then bats also gave us Ebola. So the more proximity and these like basically the shrinking ecosystem of these animals, it's going to put them in proximity to people. And so I think this coronavirus, unfortunately, might just be a rude awakening to, you know, more to come.
Yeah, that's a really good point. You know, it's pretty well known in like the biology and scientific community that, you know, when you put pressure on animal habitats, that they start to do other things. Like they start to try and adapt, and they'll get used to humans, and they'll, you know, we see it all the time, right? If you go to Mammoth Lakes in California, you know, the bears are going through the trash cans because they're adapting. And then they always say, don't feed the bears, right? We're trying to keep the bears in their own natural habitats separate from humanity. But you can't always do that with the more and more humans encroach on animals. You're right. The closer that we're going to get. And so, yes. So in this case, for the coronavirus, I think it was an animal market in Wuhan that, you know, they suggest it was either a wild cat or a snake that got it from a bat, and then that animal was then sold in the market. So China has, for now, I don't know if this is temporary or permanent, but China has for now banned the sale of wild animals in these markets, which is a big deal in China. And it's a big move by the government. They didn't do that after SARS. They just banned the sale of that specific wild cat I mentioned, but obviously people, you know, break the law, and they probably, some of them, there's still a black market for that cat. So now, after this one, that the Chinese government has decided to ban all sale of wild animals, which is a huge deal, and I think is a really good idea. I wonder if they'll keep that ban after this kind of dies down. But hopefully people will, you know, stop selling exotic wild animals on markets, because this is what can happen, especially if it's completely unregulated, right? You don't know if these, you know, it's obviously not clean. So yeah, and in natural and like the natural world as well is getting closer and closer to humanity, like you mentioned. It is a good wake up call. And you're right. I think the utopian future that we had imagined, where our healthcare system would be so good that we would never have to worry about, you know, measles again or smallpox again. Well, it might just be a different kind of virus, right? Because viruses themselves adapt. And, you know, we might have to eventually face the big kahuna, to put it lightly.
Yeah.
Hopefully not.
Yeah, definitely. Hopefully not. I'd be okay if we didn't have another plague that kills 60, or it's not plague, but another flu, like the Spanish flu, that killed over 60 million people.
Yeah, what was that? It was like 4% of the whole world population was killed by the Spanish flu or something. Like,
yeah, isn't that insane? And it was only a century ago.
That is crazy. Yeah, that is crazy. So, yeah, hopefully we can avoid something like that.
I agree. Yeah, and touching one little bit is that Guardian article I shared with you. I did want to just mention, because I forgot about mentioning it earlier, but I think they had a good point talking about transparency and communication. Basically, they highlight, you know, the Ebola outbreak, and how, you know, while it was much more fatal and worse, obviously, than this coronavirus so far. It was the communication between governments that eventually led to a end to it. And they basically,
Right.
end quotes, say the world is only as strong as its weakest health system. And like the issue with the Ebola virus, or sorry, the Ebola issue, was that in some Liberian villages, people were hiding the information. They were hiding the sick. They were hiding the deceased. And this lack of transparency just makes things worse. So I really like that the world is only as strong as its weakest health system.
Right, and especially in Africa, there's a big discrepancy in the care of health, like from country to country, from even city to city. Right, you could be on the Gold Coast and have pretty relatively modernized healthcare, but then you go out into the rural areas and it's all bets are off. So yeah, you're right, that's the weakest link kind of thing, and that's why it was so important that so many international doctors and organizations went there and helped out. It just shows that overarching kind of theme is we live in such a globalized world, and especially now with China, where you have 4 billion people traveling in and out of China every year. I mean, it's just like we have to be on the same page as far as this kind of stuff. And trying to solve the problem on your own and save face is just going to make the problem worse. And I think China is realizing that.
Exactly. That's a good point. And I mean, even like going into the United States politics for a moment, even it seems like Trump has learned that, because after the Ebola issue, he had tweeted, "Stop the Ebola patients from entering the U.S. Treat them at the highest level over there. The United States has enough problems." But he's been very quiet about this coronavirus, and I think it's because the people in his higher ups have been pretty honest with him that this is serious, and we need to face it as a country, or as a world. Sorry, and it's true. As I hear a lot of worries on the left that people say, well, of course we have Trump when we have a crisis like this, and to be honest, I think we have so many good healthcare professionals around the world that I don't really think what Trump does matters at all in this.
No.
And also, he's kept his mouth quiet, which is good. And I think he even understands that we do need to work with, the World Health Organization and Chinese officials. So that's another positive,
Yeah, and do what we can to get anyone that's, an American citizen or resident out of that area in China and make sure that they're healthy, which is what we're doing, right? We had that plane, and that's all great things. Bring them back, quarantine them, make sure they're good, and then, keep them safe. So it'd be interesting to see how this plays out. But for those listening, if you're losing sleep at night, the evidence points towards you don't have to. You'll be fine. Just stay alert, wash your hands, make sure where your hospital is. But in reality, I think we'll be okay. I think we'll be all right. But man, if 2020 has been off to kind of a crazy start.
You're so right. Like, I know we have the Australian fires, we have impeachment chaos, we have this now, we have Kobe Bryant dying. I mean,
right.
What's next? I mean, I'm sure I've missed some, but Jesus.
Yeah. Hopefully February will turn around a little bit, get some good news out in the world.
But yeah, so tell me, Drew, then I have to take a bus and a metro tomorrow to go on a hike. So you're telling me I shouldn't worry too much being in close proximity to people on this metro?
I don't think so, especially you said there's not any cases in Spain yet. Hey, but you could always get one of those paper mouth covers. What are they called? I
don't know what they're called.
Yeah, I don't know what they're called.
The paper masks.
The paper masks, yeah. I just saw that one of my buddies who's flying out to Orange County to come down to this Super Bowl party. He's flying with one of those on. You know what I mean? And I can't blame him, right? There's no such thing as being too safe, so
right. It's not going to hurt you. Though I hate to burst his bubble there, but I was reading in the World Health Organization's website, they say that those masks don't really do much once with something like this. But you know what? Whatever helps you,
Yeah, hey, if it helps you fly, anything that helps you fly with more comfort. I also heard, I don't know, I can't confirm this, but I also heard that the coronavirus reacts poorly with alcohol, So if you're watching Super Bowl out there, make sure you pound those Bud Lights, and that'll keep you safe from the coronavirus.
Maybe have a lime with your coronavirus.
Yeah, have a Corona to stop the coronavirus. Of course, obviously, we're joking. Drink responsibly, and we're not sponsored by Corona. But though I wish we were. Corona, if you're out there, sponsor us. That'd be dope.
Yeah, yeah, but you're right. Yeah, whatever makes you more comfortable. Washing your hands is the key. That's really the
Yes.
key. I even bought some hand sanitizer. Working at a school part of the week, I decided that could only be helpful.
Yes.
But yeah, I just think the world needs to calm down, and the one side effect I think of all this social media and mass media is the fact that there's a lot of things spreading that are just not true. And it did not help, though, when I think it was John Hopkins in October ran a model of the coronavirus and said it would kill 65 million people.
Yeah, geez.
Like, that is not a good feeling, even though so far so good. Some people, I guess there's reports, some people were going on to that game called, I think, Plague.
Plague Inc.
Yeah, Plague Inc. Quite a fun game, I have to say. But I guess people were going on there and creating a coronavirus and seeing how many people it killed. It's like, all right, guys, this is not science. And the company had to come out and say, okay, this is to learn about how a virus spreads, not to give you facts.
Yeah, this is a video game for entertainment. Like,
Yeah.
please don't go. Moving to Greenland is not an end all be all.
No. Well, any last thoughts on this to worry us anymore, or do you think that's about it?
No, yeah, no. Again, I don't really worry out there, people. Just stay clean, stay safe. And then it's just a great example of how globalized the world we live in is. It's important to be a global citizen and to be have coalitions of governments to help this out. Because if we didn't have the cooperation with the Chinese government and the World Health Organization, it could have been a lot worse.
Definitely could, and maybe don't go to Wuhan either.
Yeah, yeah. I think. Hey, though, in 8 months, I bet you hotel rates at Wuhan are going to be dirt cheap.
Yeah, if the economy hasn't collapsed by then. I don't know.
All right, folks. Well, thank you for tuning in. We're obviously a little facetious at the end here, but again, stay tuned for more episodes. Yeah, we want to hear from you. Are you worried about the Wuhan coronavirus? What's your take on the reaction that the Chinese government has had? Do you happen to know someone that has it? That would be incredible. We would love to hear from you.
Yeah, definitely.
All right. Well, thank you for tuning in.